Hello, I am Dr. Rajasekhar M from Chirag Global Hospitals at BTM second stage, Bangalore. Hemorrhoidoplasty. What are hemorrhoids? Hemorrhoids and piles are one and the same. In medical terms, we use hemorrhoids. Common man calls it piles, which are nothing but bunches of blood vessels arranged in three groups inside the anal canal. Everybody has. They are called anal cushions. They act like valves to prevent escape of air and all. So, when more blood flows into those hemorrhoidal tissue and they enlarge, clinically we call them as hemorrhoids. So, those whoever has got small hemorrhoids, we need not treat them or operate them. There is a lot of issues that are going on because some hemorrhoidal tissue is seen when they are examining and they advise surgery. Hemorrhoidal surgery is advised only for symptomatic cases. What are the symptoms? Only three symptoms are there. One is patient is having bleeding because of the hemorrhoids. The blood vessels rupture and they are having bleeding. It has to be treated. If they have become too big and they are coming out and to be pushed back, they are bigger, then it has to be treated. Or sometimes blood gets clotted in that, called thrombosed hemorrhoid, you have to treat that. So what are the different varieties of treatment? So one is we remove the whole hemorrhoidal tissue. That is what we were doing till recently. That's called excision or hemorrhoidectomy, which is a real painful condition because there will be big wounds and then postoperatively a lot of pain and it takes long time to heal. Postoperative bleeding, all those used to be quite common when we do hemorrhoidectomy, that is surgical removal. Nowadays we are not doing in bigger centers and all, we do different procedures. Hemorrhoidoplasty is one of that. Using lasers, we'll put the laser tip into the hemorrhoidal tissue and burn it. It will all shrink. That is one of the methods of doing, but that is not a panacea for all hemorrhoids. It should be properly selected and done properly using the proper laser machine. Laser machine should be good. Laser fiber should be proper. You have to use the correct fiber. There is something called radial fibers exclusively for hemorrhoids and can't go on using it for many number of cases. Why I am explaining all this is, people think that laser treatment we do anywhere, it will give the same result. No, we are facing a lot of issues, either too much of damage that is done because of improper usage, patient coming with strictures, or inadequately done, be effective, again they are having hemorrhoids, bleeding and recurring. So hemorrhoidoplasty and all should not be taken easy and it should be done in a properly trained center with properly trained surgeons. Then only you get the correct result. So the hemorrhoidoplasty is one of them.